Good afternoon, everyone. Welcome to our presentation today. If I could get everybody to stand, we're going to do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So, I'm going to introduce Dr. Singh. He's going to come up here and he's going to do his presentation. He also has some assistants in the back, administrative assistants, and I'll have him introduce them. Also, there will be a question and answer period. You must come up to the podium. I'm not going to run around giving you the microphone. You must come up to the podium because this is being broadcast on Channel 97, and we need to hear you nice and clearly. So without further ado, I'd like to introduce Dr. Singh. He is the Chief Medical Officer and Medical Director of Emergency at San Gregorio Memorial Hospital.
Perfect. Hello? Can you hear me? Yes. Hi. How are you guys doing? You guys survived the heat to coming here from outside. So that's the first victory for today. The second victory is hearing me talk for the next hour. So my condolences. Let's see if you guys can make it through. So I guess a little bit of background about me before I go about the hospital. So I've been a practicing emergency physician at San Gregorio for a little over 5 years. I was supposed to be here for 2 years. Supposed to come to the emergency department for operational improvement, and then here I am 5 years later. I got recruited for a short amount of time, and it was supposed to be primarily to kind of recruit physicians that would normally go to Los Angeles, San Diego, but then really didn't know about this area. And I, honestly, when I got this job offer, I had to Google where Banning was. And I've been a Southern California kid all my life. I went to college at UC Riverside. I did my medical school at UCLA, and then I did training at Loma Linda. So I've been in this 50-mile radius most of my life, so kind of homegrown California, but did not know about Banning. So, which today is a very, very growing population, Banning, Beaumont, as you all know. Who's sick of the traffic? Yep, exactly. So, but I think growth is good, change is good, and I think that's kind of where our hospital is going forward. So let me just get the clicker. Let's see if this works. Yep, perfect. So the reason why I'm here, some of you guys are wondering, like, why is this guy here? I got better things to do, take a nap today, eat a sandwich, and I'm here at 1 o'clock listening to this young kid talk. And really, it's to kind of leave the four walls that were in the hospital of you coming to us in the hospital in your time of need, and us really not really reaching out to you. And it's really doesn't work that way for long-term partnerships. We're here to serve you. Can anybody tell me who owns the hospital?
We do, the patients. We do, the patients.
Good. Right? Every single one of you. It's a district community hospital, right? So every single one of you owns a hospital. When I go to work, there's that sense of ownership as a physician that I hope every single person, whether they're the housekeeping staff, whether they're the dietitian, whether that's a physician, a nurse, they all have that sense of ownership of I'm going to my place to provide the best care and need that I would want my family members to receive. And that's the premise of the mission we're trying to employ at that hospital. So kind of going over the overall mission, which has been established for a long time. I know it's hard to read and it's a little bit far away, and I'm really farsighted, but it's to provide the first word, if you can read it, right? To provide safe. And that's our goal, to provide safe, high-quality, personalized healthcare, right? Personalized, I don't know if that means concierge the doctor, but for now, we're going to stick with safe and quality, because at the premise of all of this, the reason why I went to med school, the reason why of all the specialties, emergency medicine was my calling, and I felt the higher power telling me this is what I need to do, that was because I wanted to have training where I can help somebody in their darkest hour, right? You have no idea what's wrong with your family member, with your loved one, and you're putting all this trust in this stranger who has a white coat on, which could be a Halloween costume for all you know, but they're supposed to, take care of your loved ones. And it's a lot of trust that you automatically give without even knowing me, without even knowing my name, without even knowing what I do, where I was, and what did I have for lunch, and if I'm a crazy person or not. There's a lot of trust. And that's a trust that I want to have for our community in our hospital. So this is the picture I found in our archives of what the hospital used to look like way back when. I see some nods, so I'm sure some people have been around where they saw this hospital, and they've been in the community, they grew up with the hospital, and kind of this is how it initially was before we kind of built the new emergency department and the new ICU. There's been a coming of age of this community, as the joke of the traffic is being horrendous, but that is the coming of age of the community as well as our hospital. And the community is exploding, right? If you look at our exponential growth of the population in Beaumont, it's just skyrocketed. So the hospital needs to grow, and the hospital needs to adapt to what's going on around it so we can meet your needs. If you go to our website, the first thing you see, right, about us, built by the community for the community, right? That's our take-home message, is it's all of you that own the hospital. It's built by all of you with your support, and I know there's been a lot of measures that you've supported, all the bonds that have been floated over the past years. That's why that hospital has survived and will continue to thrive in the near future, because of the support from the community. So really, why am I here today is to kind of look at where have we been in the past few years, where we are today, and kind of where we're going in the near future for your hospital. So kind of the two basic things that a community hospital really needs to have is being reliable in the time of need, being able to provide you with the services you need, right? Of course, can this be a Mayo Clinic or a Cleveland Clinic? No, right? Those are the tertiary centers that a very small subset of hospitals in the United States have, and they have research and all that. But our goal, our mission, is to provide safe, quality, personalized health care to each and every one of you that lives in this community. So that kind of started our journey to say, okay, where do we focus? What do we need to do? What are the needs that the hospital needs to address to really address the service needs of the community? And that really started with the lack of physicians in the area. So this is from the California Health Foundation of the small number of physicians compared to the number of overall population. So California, I know it's, again, a hard slide to read, but if you look at on the, I don't know if this has a pointer right here, this is primary care and this is specialist. So there's about 35 doctors per 100,000 primary care. That's the lowest in the entire state of California for Inland Empire. Okay? Next thing, specialist, right? So I'm not talking about the plastic surgeons and all the fancy stuff. I'm talking about the general surgeons, the cardiologists. We are 64 for 100,000, and the California average is about 104, and we're the lowest, Inland Empire, right? So when I went to medical school, UC Riverside, didn't have a medical school. We partnered with UCLA, and part of the mission was to bring doctors back to this community so they don't all stay in Beverly Hills and do Botox, right? They come here and actually provide good clinical care. And that's how the UCR School of Medicine got built and the mission behind that, and that's how the residency programs kind of got started in the area. So there's a huge need just by the fact that Inland Empire, there's a huge need for doctors. And I think some of you are probably aware and have felt that also, being in this area. So physicians for our community. When I started, we had cardiologists, we had intensivists, pulmonary physicians, we had emergency physicians, we had hospitalists that would admit you to the hospital. So if you came in, I have chest pain, so the ER doctor would see you, then you get admitted to the hospital by a hospitalist, you would be seen by a cardiologist, and then you would get discharged if everything is okay. And that's kind of how it worked. And we had some GI physicians as well, and OB physician and general surgeon. That was kind of our basic panel of physicians that we had. But we really didn't have a lot of other specialty coverage. And what we learned over time is we were transferring a lot of patients out of the hospital. And I think some of you have felt that if you've been a patient there. Sometimes we used to not have the services available, and we used to transfer patients to other hospitals in the area, which is really frustrating. And when I started working here, and I found that really frustrating personally, I'm trying to take care of this 80-year-old patient that has a kidney stone that has to be admitted, but I don't have the kidney stone doctor, the surgeon, the urologist at the hospital. So I have to transfer them to a hospital 20 miles away. And then their 85-year-old spouse is trying to figure out how do they drive, how do they get around, how do they take care of the dog, how do they, all the life stuff when it's their hospital that they've supported and it's not able to provide that service. So really disheartening just from a personal standpoint. So the blue on the left were kind of our initial focus, and this was orthopedic surgery. That accounted for 15% of our transfers. Urology, like I talked about, the stone doctors, that's kidney stone doctors, about 6%, and about 30% was neurology, so patients that needed a neurologist. So we had to transfer a lot of patients out. And that's kind of where my personal journey, along with the hospital's journey, kind of started of looking at how do we bring this service to you instead of you going out of your own house or out of your own community to get the care that you deserve and you need. Since in the past 5 years, we've added a whole panel of new specialists. So we've added on neurologists, we've added on urologists, more general surgeons, orthopedic surgeons, vascular surgeons, spine surgeons, as well as GI specialists. So we've added on a whole new panel of services that we really didn't used to have. And as a result of that, this entire blue is gone. So we have decreased our transfers to other hospitals directly from the emergency department by about 45 to 50%. It's amazing, huge results, right? Just having the basic infrastructure of meeting the needs of our community, meeting the needs of everyone in this room and your family members. So the doctors, I'm not going to bore you with all these slides, but just some of the doctors that you may have seen in clinic or in the hospital. Dr. Shaw, he's the medical director for our ICU. He's been trained for many, many years in the Naval Academy. Dr. Roger Schwaltz, you might have heard some of his podcasts about COVID. He's really renowned on YouTube. Dr. Sammy Hanna, he's an interventionalist pulmonologist, so a lung doctor that started about 1.5 years ago. Cardiologist, Dr. Hildebrand, he is by far my favorite doctor I've ever worked with. He's like the dad that you don't want to disappoint. He's just gentleman of gentlemen. But he is any advice I need about getting my head straight, I go to him. He's great leader for our organization. Dr. Bob Creek, he was at Rush for I think over 20 years. He was an academic cardiologist, transitioned over here. Great guy. Dr. Lindsay Ahmed, she went to UC Riverside actually. Fun fact, we went to college together, didn't realize it, and then she went to USC, I went to UCLA, and now we're working at the same hospital all these years later. So kind of exciting that we're recruiting young physicians to this area. We've added on general surgeons, Dr. Henry Nguyen. I used to work with him at Riverside University Health System. He's a general surgeon. He's a trauma surgeon, and he works at San Gorgonio, takes call 1 week out of every month. And then we have Dr. Depew, also academic surgeon in the past at Riverside University, now works at San Gorgonio full-time. Orthopedic surgeons, we have Dr. Ghazal, Arrowhead Orthopedics Group. So all of their surgeons, Peter LCC, his younger brother went to medical school a few years after I did at UCLA, but both of them are orthopedic surgeons in the community. So all of these surgeons are covering our hospital. in case you come in for a hip fracture or one of your family members falls. Dr. Amin, I used to work with him at Loma Linda. He is just starting next month to provide orthopedic coverage at our hospital as well. So more doctors are coming, have come, and will continue to come across multiple specialties. Emergency medicine, Dr. McCarty, he actually used to be one of my medical students. So that's how I know I'm getting old, is I'm now hiring my own medical students that I've trained. I still teach at Loma Linda, but I don't like working with him. I was working in the ER before coming here, and I just signed out my patients to him. And every time I look at him, like, you remind me that I'm getting older and older and older. So, but yes, he's definitely a very talented doctor. He works also part-time at Loma Linda as a attending as well. Dr. Naud, she's going to be our medical student educator as well. We recruited her out of residency about a year ago. So she's been a great addition. Dr. Mancheski, she's the associate medical director of our emergency department. We recruited her out of University of Texas a couple of years ago. So a lot of new doctors that are, Dr. Rossi, he used to be my medical student too. And he's now, I think, the quality director of at Loma Linda emergency department as well, and he works at San Gregorio. So that's the ER craft, and then this is our hospitalist, Dr. Schwaltz. Dr. Liu, she's fantastic. She's one of the nicest hospitalists I've ever interacted with. When you are admitted to the hospital, she's providing care to you. She's available at all times. We have a 24/7 hospitalist program. What that means is at any time in the hospital, there will be a hospitalist, trained internal medicine physician that will be able to provide care for you if you have any pain that you need to address for any medications or anything that goes wrong in the hospital. There's always that physician in-house looking over your care. So no one's at home just watching Netflix. Somebody's in-house. Urology, Dr. Jellison, nicest guy. He's actually operated on some of my family friends. Nicest physician, surgeon that I've ever encountered. Dr. Koh, he trained, I think, at Mayo Clinic. Really smart guy. Vascular surgery, this just started 2 months ago with Loma Linda. So Dr. Abu Zamzam, he's their director for their fellowship program, but they're providing services to our hospital, Dr. Teruya. Kristen actually used to be a co-resident with me at Riverside University. So her and I trained together, and now she's at Loma Linda full-time, but they also take call coverage here, and they operate every Friday. So anybody that has any vascular surgery needs, they see Loma Linda physicians, they can actually get their operations at San Gregorio now. So that's really the cool piece of all of this is you're now able to get your elective procedures right near your home. You don't have to drive far. Dr. Murga, Dr. Leong, so a whole bunch of doctors. So really, where did all of this start? This was recruiting the doctor. That was just the base infrastructure. If you're building a house, you can build it as high as you want, but if you don't have a good foundation, it's going to get trickled over, right? So we had to start with a good foundation of what do we need, and that started with having the right doctors and the right nurses. So that's where we got the doctors. The next step was, okay, well, the ones that are ready to retire, they want to retire now, and they want to be done with this, right? COVID and all that stuff, and they want to be done. So how do we bring upon the next generation of physicians to this area? How do we incite them to come here instead of being a beach bum and surfing and then going to work, right? How do we have them come to Banning, California? So really, one big of all of this was to start a training program. And that's what we started. So last year, we actually started a residency program. So we're actually a teaching academic hospital now. And so what that means is now we actually are partnering up with UC Riverside School of Medicine. They have started an internal medicine program, and the residents have been rotating for about a year, and they will continue to do that. We have about 25 residents that we get every year. So each month we'll get 5 new residents that are rotating through for the internal medicine program. The residents are rotating at San Gregorio, at UCR, at their clinics, at St. Bernardine's Medical Center, at the VA, and the Loma Linda. So they're getting a robust kind of overall education, but we are one of the main sites as well. In addition to that, we also started a fellowship, so a critical care. So when you get admitted to the ICU, if your family members are really sick, we actually started a fellowship. What fellowship means is, my last 10 years of my life, I have no idea where it went because it was in the library, but it was we do 4 years of college, right? 4 years of medical school, and then we do about 3 to 5 years of residency training in the whatever specialty we choose. And after that, if we want to do another subspecialty within that big, broad, like if you want to be a general surgeon, you'll do 5 years of general surgery. And after that, let's say you want to focus on, say, I just want to be like the trauma guy, or I just want to be the hernia guy, then you can do a subspecialty, a fellowship. So we have a fellowship for internal medicine residents. Once they finish their 3-year and they're full-fledged doctors, they actually do 2 more years of training in critical care medicine. So the sickest of patients that are in their ICU that you hear, that's the training program we have. So we get those fellows as well. So we're training them as well, in addition to the residency program. And they're actually in-house. So that was the clinician piece. We kind of started that foundation about 5 years ago, 4 years ago, and it's been really fruitful. And the residency and the fellowship program started last year, and we're planning on starting possibly a neurology residency as well, in addition to all of this. So lots of plans for the future. So the next bucket is really quality, and that's where the second mission was, right? So safe, having the right doctors, the clinicians. Now it's quality. So how do I address quality? Well, it's very hard to kind of quantify how are we doing in terms of, well, I can't really do trials. Oh, if this guy comes in for pneumonia, let me give him this treatment versus that treatment. Let me see who dies first, and that doesn't work, right? Medicine is, there's a certain set of standard of care that's established. And then from there, we measure how do we perform. One of the hardest challenges for me as a physician has been trying to understand that I'm not end-all, be-all, and that's the hardest lesson for all physicians, I think. If you look at I teach, because I still teach at Loma Linda and Riverside, medical students and residents, we're kind of in this environment where we're almost neurotic by our environment, and we're also just in this paranoia at all times. If you look at our careers, we went from high school and we wanted to be really good and get into a good college, and then it's like, all right, good. You go to a good college. And then in college, it's like, okay, well, I need to get into medical school. I went to UCLA. The acceptance rate when I went was 2.6%. So, of course, there's competition there, and you're trying to be the best, and you're trying to be competitive with everybody because there's only so many, there's 120 spots for 4,000 applications or 5,000 applications they get every year. And then you get into medical school. And then after that, you're trying to compete to get into a residency. You want to be near a family. You want to be by the beach. So there's all this competition that never ends. And then we do residency. And in residency, we're all trying to compete to be the best doctor, to learn all the procedures, to learn all the medicine, get everything, drinking water from a fire hose. And then we get trained, and we get spit out into the real world, and they're like, all right, go be a team player. All right, it doesn't really work that way, where in my entire life, I was trained to be this competitive and all this person, where the real world environment, when I'm working alongside nurses, that doesn't really translate. So one of the things that we can have the best one doctor or the one brightest nurse, but if they're not working together cohesively as a team, you're not going to get anywhere, right? Communication breaks, and at the end of the day, it's your family member that's going to lose, that's in the hospital, because they're not going to get the best care. You might have the one best player on the team, but if they're pulling everybody out and they're breaking the team chemistry down, you're not going to win. So it's really about leading teams, and it's really about doing right as a team of taking care of the sick individual in front of us. So one of the things that we're looking at for us as being a center of excellence is something called sepsis. Has anybody heard of sepsis before? Yes? So sepsis is fancy word for you got probably some sort of infection. We don't know what it is. It could be from multiple things, bacteria, fungus, virus, but it's potentially can cause your organs to fail and then eventually cause you to die, right? So it is very fatal potentially. Signs and symptoms, cough, congestion, if it's a pneumonia type deal, you don't feel good. People that are at risk for it are immunocompromised, they have medical problems, diabetes, over age 65. So just a whole bunch of things that can put you into sepsis. Looking at the numbers of the deaths in just United States, every year, about 270,000 deaths, right? You don't hear about it a lot because it's not really sexy, right? It's not like the big car accident death or whatever, right? It's this sepsis. It's like kind of this, you get a pneumonia, you get admitted, you get worse, and then you pass away. California itself, about 40,000 on average deaths. So really, really high mortality rate if you do get a bad infection. So our goal kind of started about 5 years ago, and it was to look at how do we get our team together. And this is our team. So this is not just nurses. This is a respiratory therapist. This is a nurse. There's some doctors in there. There's some charge nurses there. This is one of my friends from Loma Linda that's giving a talk on pediatric sepsis. And so we get together to look at what are the best practices. How do we take care of these patients? And how do we improve their care as a team? And what does that mean? You can read about it in a book, but you got to really execute it together as a team. And so if you go to CMS website for Medicare, look up the hospital and look at our scores, this is what you'll find. So you'll find that the state average for California for sepsis compliance is about 64% for all hospitals, all of California. Across the nation, about 57% compliance in terms of how appropriate care is for a patient with sepsis. And by appropriate, I mean, did they get antibiotics in a timely manner? Did they get fluids for their dehydration when they have an infection in a timely manner? There's a bunch of things that we do, getting blood cultures. I have Angie, who's our nurse in the back. She's our ER director. I drive the nurses crazy sometimes, and she will say yes, because everything has to be in a timely manner. As soon as you hit our triage and say, my name is Bob and I have a cough, our shot clock starts then, because we know the longer we wait to give you that, the higher chance of you going into multi-organ failure. So where are we in terms of looking at our performance? So these are some of the hospitals, and we're at 83% in this area. Right? The only one that's close to us is Kaiser, Moreno Valley. They're 85, 83. So not a huge big difference, maybe one patient, right? So this is Redlands at 70. I think Loma Linda's here, Desert Regional. They're all below that average, right? And you can pull this up I looked this up last night to update this. So this is all up to date on the CMS website. So really, our quality of care is pretty impressive. And these are the numbers that you might not hear about the care, right? You'll hear the anecdotal evidence of, I went to St. G and this happened and that happened, but I'm here to share the data that's out there. In addition to that, we are now a accredited geriatric emergency department. So what that means is there's a certain threshold of quality metrics that we meet with American College of Emergency Physicians for our emergency department care that we have met and we continue to meet for the past 2 years, that we continue to get this accreditation for our emergency department, given the patient population that we have in our pass area. All right, so now looking at service. So that was clinicians, quality, and then now the service piece, right? So this is your neighborhood. This is your home, right? What kind of service are we providing to each and every one of you and your two family members? One of my surgeon friends, they all got trained on these robotic surgeries. Have you guys heard of the robotic surgery? Yeah. Has anybody gotten a robotic surgery? Yeah. So robotic surgery, it's not a robot operating on you. That will probably happen at some point, but not yet. But it's a surgeon that's using technology assistance to ensure that they're doing the surgery in a safe manner and they're not causing a lot of damage, and they can do it in a minimally invasive way. So if the surgeon moves their arm here to here, the robot arm that's on the patient is only moving maybe this much. So you have a lot more room. So it's pretty interesting. And a lot of the surgeons now, my friends that got trained at UCLA, they all got trained on it. So when when we expect these young kids, as I call them now, to come out to Banning and leave Beverly Hills, right? How am I going to bring them here? Well, they want to have the same technology that they're already used to. They already, there's 100 ways to skin a cat, but they've already been trained that way, right? And so how do we bring them here? So part of that discussion was to bring that technology to our hospital. So we started robotic surgery as of April of this year. So this is the robot. This is the arms that go into the patient that decreases your length of stay in the hospital, that decreases your scar formation in your belly if you were to get surgery on your belly. And looking at literature of surgical journals of what, is this just a fancy toy for the doctors to play with, and they just, want all this fancy stuff, and does it really mean anything? There's been a lot of studies that have shown that robotic surgery all across the country is on a significant rise as of 2012. So you see that huge increase. And it's translated to decreased costs. It's translated to patients leaving the hospital quicker, recovering faster, having less scar formation compared to open surgery. So service, right? Service to the community. And part of that is also, these are all the hospitals in the area that have robotic surgery. Why not us, right? Why can't our community hospital in our home have that service? Why does somebody, your neighbor, your family, your mom, your dad, your son, your daughter, your sister, have to go to another hospital to get this service? And so this is kind of the platform for we have in our OR now. And the surgeries that we do are for urology, general surgery, and gynecology. Those are the three main, most common surgeries. There's also other specialties you can do it to, but these are the main ones. So it's a huge service. And not only is it a service for you, but it also attracts the new doctors coming to this area. Now you have a whole new talent of really well-trained doctors that we can recruit from, the Mayo Clinics, the Cleveland Clinics, the Harvards, or the UCLAs, and bring them here to practice medicine and take care of your family. So this is kind of how it works. The patient's usually here, the surgeon's operating right there, there's a tech and a nurse, and you're able to see a camera there, and that's how the operation happens. Super cool. Super cool. Yeah. That's our surgical team. That's the actual robot in our OR. That's our team. Yep, that's pretty cool. And then we had our first patient in April. We actually gave that patient a certificate that you're our first patient, so it was really cool. The staff in the back, Allie and Ariel, they actually helped create that, so that was really cool for them. And really, if you look at all it's a fancy toy, but really it's clinical outcomes. It's your mom getting discharged sooner, having a smaller recovery, your sister having lesser of a scar to deal with later in their life. And then service to our community, and then it's also bringing over, now we're able to train up our staff, train up our nurses, train up our techs that work at the hospital, so they have more skills than they had when they came into the hospital. So kind of the full circle. So again, service, right? Reliable in time of need, and to provide care within the community. That's the premise of the goal for us. So looking at a service, another service that we're looking into for us is our stroke patients. How many of you know in this community somebody's had a stroke? More than likely, if you call 911, if I have a stroke and you see me go like this, and I have a stroke, right now you call 911, ambulance, paramedics will come here, and they will take me to Redlands, Desert, or Loma Linda. There's a freaking hospital right here. Take me there. No, because we're not a stroke center yet. How big of a disservice is that, right? But if you put me in the back of your pickup truck and take me to San Gregorio, we'll take care of you, but the ambulance, because of the regulations, and we're not a stroke center, right? So that's our next service that we're planning. Has anybody heard of the gift that San Gregorio got from Morongo Band of Mission Communities? Right? So Valerie Hunter, she's our foundation director. We got a $5.5 million gift from the Morongo Band of Mission Indians to start our stroke program and a stroke journey. So it's a huge, and I use this for her, and they're probably sick of this analogy, but if Betty here at Sun Lakes has a stroke, she won't be brought to San Gregorio, right? So facial droop, weakness in one side of the arm, can't talk, can't use their limbs, can't feel their limbs, that kind of stuff. Brain, something's going on with the brain, right? You call 911. This is kind of the overall map. We're kind of right here, right? You see this blue H? That's us. So this whole area, this is Hemet. This whole area has nothing. Where are these patients going? They're going either here from the ambulance or they're going here. And what does that mean? What that means is every minute we delay, every minute you're in that ambulance, your brain cells are dying. It's not good, right? It's kind of like heart attack. So heart attack care, that's how heart centers kind of got started. Time is muscle. You guys might have heard that from before. That's the same thing. Time is brain. So this whole catchment area, there's nothing. So these patients, unfortunately, go here, and there's a lag. And we know that we have to get the certain medication within the start of your symptoms. Let's say I have a stroke. What is it? 1:35. So I have about till 4:30 to get that medication in my body. Otherwise, it's not gonna. Nobody will be able to give it because the guidelines aren't there, and you'll just have a permanent disability for the rest of your life, right? So time is of the essence. So that's really where the next focus that really our team that's in the back, myself included, is really putting our next focus on, is we need to bring the stroke center yesterday. So again, built by the community for the community, right? If you came in in 2019 for, you say you brought your neighbor in and say, okay, well, Bob is not moving his left arm and he can't talk. We'll be happy to take care of Bob, but I would be there in the ER. I would be able to give them the medication, but I would have to transfer them, right? We didn't have a neurologist back then, 2019. So we did all this fancy stuff. I gave him all the stuff that I learned in medical school and residency, but I would have to transfer Bob out to other hospitals. So then we started our Tele Neurology program, which is the neurologists that are in the hospital now. So right now we have the Loma Linda doctors that come in whenever somebody comes in for a stroke, bring them on a big screen like this, like an iPad, and they're able to see the patient within 2 minutes on the screen. So now, if somebody brings their neighbor in, drive them in, and they have a stroke, we give them the medication that I was giving right before I left for a patient, and we're actually admit them to our ICU because we have the doctors and we have the neurologist. So that quality of care is still there, right? It's just the ambulance traffic is not coming in if you call 911. And I don't want you to delay and not call 911. That's not the message here. But the message is we need to have those ambulances come to your home, to your hospital, right? So how do we do that? So right now we have our stroke team, code stroke gets activated, we have doctors, nurses, we just swarm that patient like a bee. Like today we had a patient with a stroke that woke up at 10 o'clock and we activated the code stroke in triage as soon as it said they couldn't talk, and a swarm of people just came in from all over the place just to take care of that patient right away. Part of that gift that I talked about for us to qualify, why are we not a stroke center? Things that we need to become a stroke center are, we need 2 different CT scanners. In case somebody's getting a CAT scan and a stroke patient comes in, we need to be able to utilize a second CT scanner. So that's why we need 2. We only have 1 right now. So that's where we're constrained in the past. We need to have an MRI machine that's available for our patients. We have one, but we're purchasing a new one as part of the stroke program as well. So a lot of technology things that we needed to kind of purchase to be able to qualify ourselves as a stroke center. Like I said, it comes with a teamwork. All right, so today we have the doctors, we have the nurses that are trained. Angie Brady in the back, she's like I said, the director of our ER. She's overseeing a lot of the stroke program. We've already done education with our nursing staff in the entire hospital of stroke care. We have a lecture for the doctors coming up next month as well, just a refresher of, what's the newest and best guidelines for stroke patients. So that's our journey here. We have started our process of looking at the construction and all that stuff for the CT scanners and the MRI, and once we have all of that done by this time next year, we should be very close to submitting our application, becoming a stroke center. So that's kind of a journey. There's a lot of regulations that we go in. The stroke center is not just, that's the four walls. That's where the hospital exists, right? It's not that at all. Part of that is going to be me coming out here. We have a stroke medical director that's with Loma Linda, and they're going to be coming out here to do education for each and every one of you, right? How to identify stroke patients. What do we do for stroke patients? And that's part of our commitment as a stroke center, that we will be held to that standard, that we come out here and deliver for you guys. So it's part of that community piece in terms of the overall stroke center. In terms of the overall path for the hospital, I'm very proud of where we are. We have added on new anesthesiologists to our call panel that deliver care there. Our OR has never been busier than before, so we're really busy. We would like to be busier as we provide more service to each and every one of you in the community. We're growing more residency programs. We are also having medical students come and learn. So we have nursing students, we have PA students, and now we're going to have medical students. And then we also have people that finish medical school, which are residents, they're already there, and fellows who have already finished residency. So we have the whole circle now of organically training our own people. And so once I think the most recent statistic I saw was 70% of doctors stay wherever they train. So that's a big, I fall into that statistic. I trained right here in Inland Empire, and I'm still here. So 70%, and that was really strategic to make sure that we keep the doctors in this community, because this community is growing. Things are getting more complicated. We need to have the best and the best trained. And if we can really teach them to take care of you, right? They learn from you. They're learning as they go. Of course, there's a whole piece of their academic piece, but they're actually learning how to take care of this patient population. They're not learning how to take care of somebody in Kansas and then coming here. They're learning in this community. And the goal is to provide that care to this community later on. So that's all I had formally. I would love to kind of open it up to questions, whatever you may have. Yeah.
Remember, if you would like to ask a question, please come up to the podium. Oh, come on, I know someone wants to ask a question. Virginia?
My question for you is, because people have different group medicals, things like that, I see that you have a bridge between Loma Linda and that hospital. Does that continue? Because myself and my husband, our Medicare group is with Loma Linda. Mm-hmm. So if we go there, we'll get that treatment and stay there, only if it's provided prior to being taken to Loma Linda. Am I right?
Yeah, that's a great question. So healthcare is probably the most complicated thing in this entire country. Some of you may have heard Amazon and JP Morgan got into this whole big company, and they tried to create this big organization to address the needs of healthcare, and it just dissembled because healthcare they concluded it was too complicated. And the healthcare is really complicated. And part of that is the doctors, yes, they provide care at the hospital. I'm part of that as well. But the doctors don't work for the hospital, right? We're affiliated with the hospital. So what that means is we have the Beaver Medical Group, right? That's been part of that hospital for such a long time. They provide our hospitalist service. They provide our intensivist, our pulmonology, general surgery service, and part of our other groups as well. Anesthesia used to provide that care. In addition to that, we have Loma Linda providing care for vascular surgery in the hospital. They're providing neurology care in the hospital. They're providing urology care in the hospital. So it's not that we're only tied to one group or one entity. The goal is to get the best and the brightest here, to bring them to you, so you have access to them.
Hi. My question is related to sepsis. I'm scared to death of it. I don't stay overnight in the hospital unless I absolutely am close to death or in a coma. You have a good treatment program. How much sepsis do you experience in the hospital at San Gorgonio?
That's a great question. So we're actually pretty busy. The qualification for sepsis is we look at different markers. We look at something called objective versus subjective. Objective is if your heart rate's high, you have a fever, you're breathing really fast, your blood pressure's low, and then we think you may have an infection in your body, that's sepsis. And sepsis starts to get worse. It's kind of the way I teach it to my students is sepsis is like, you have this terrible infection, you're in the middle of the desert, you don't have any water. Your body's like, okay, well, I need my brain and my heart to survive. Don't really need my kidneys. So let's just shut the blood supply off to the kidneys. So the kidneys stop working. That's usually the first thing we see. And then, like, well, I can still kind of limp along. Let's maybe not give the feet some blood supply. And then the feet go. And then, well, maybe I'm not going to get food in the desert anyways. I'm not going to get, Papa John's pizza here. So let's just shut the blood supply off to the gut. And that's usually what sepsis happens. And so the risk factors for sepsis are patients that have diabetes that decreases their immune response to the infections. Things that are like being overage, taking certain medications that immunocompromise you. We do see sepsis a good proportion because the population that's in the area is at risk, right? Age over 65, a lot of medical problems, asthma, history of COPD. So those are all a bunch of things together that automatically increase your risk for having sepsis. Don't be scared of the hospital, right? Don't be scared to death of the hospital because we're there to do that, right? It's like if your car is leaking oil, you're not just going to keep driving around in it because you're scared to go to the mechanic because he's going to charge you a lot of money or whatever, right? Or they're going to find that the air filter's broken and you got to get new tires and you got to get this and you got to get that and blah, 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 right? We do what we do really well. So if you are sick, trust the hospital. Come to the hospital. You're not going to get an infection because you're at the hospital. We have a lot of protocols in place from our infectious disease nurses, our infectious disease doctors in regards to our COVID restrictions, our overall infectious disease restrictions that we employ so that you are protected so you're not picking, extra infection while you're in the hospital.
Quick question, but I just had a comment.
Yeah.
8 years ago, I had sepsis. It's a nasty disease. I was in the hospital 4 times in a period of 3 months. They couldn't control it. Mm-hmm. Fortunately, they finally got it. But as one physician came in and told me, you're lucky to even be here with what you went through. It's nasty. Mm-hmm. But my question is, when you're an accredited stroke center, are we going to be for clots and hemorrhagic strokes? Both of them.
That's a great question. So you have a lot of vocabulary. Did you work in healthcare?
My wife had a stroke.
Okay. Hemorrhagic, I'm sorry. So fancy words. There's 2 types of strokes. One is an ischemic stroke. That's your typical kind of the equivalent of the heart attack. You're not getting enough blood flow to that part of the brain, right? So whatever issue that is, maybe you have a history of atrial fibrillation and there's a clot in your heart and that goes up to the brain and that clogs up one of the arteries in the brain. Or you have a bunch of cholesterol plaque built up in your brain, one of the vessels, and then the blood supply decreases, and then the brain cells start to die. So that's one piece of it. Hemorrhagic stroke is a head bleed, and that could happen for multiple reasons. So if you trip and fall, trauma, that can cause you to have a head bleed. If your blood pressure is really highly uncontrolled for many, many years, and one day it just goes really, it's like, trying to drink out of the fire hose, the pipe is going to burst if you put too much pressure on there. That's kind of the idea of the bleed from there. Or you have other underlying problems, so there's a bleed in the brain. So the first type of stroke is a normal kind of, the stroke that I'm talking about is we're a stroke center. The hemorrhagic stroke is primarily taken care of by neurosurgeons. We're working on it's funny you asked that question. For the neurosurgery piece, we're actually in the middle of negotiating neurosurgery services at the hospital as well as we developed a stroke program up. Now, to do brain surgery, you need a whole equipment, you need a whole program. Eventually, we'll get there. Are we going to get there tomorrow? No. But are we going to get there? Heck yeah, right? Because it's not that, oh, this population, this doesn't even get those, so we don't need to have that service. No, right? We need to have that service, so we need to have a good foundation first. So that foundation start with taking care of your normal strokes that you hear about, which is not getting enough blood supply to your brain. So if you come into the hospital, we're that stroke center. Once we get our accreditation, we will be able to give you the medication that you need to bust the clot that's in the brain that's causing the stroke in itself. Every now and then, for a very small subset of patients, so let's say 100 people have a stroke, out of those, maybe a few percentage, less than 10, will have a big clot in one of the big vessels in the brain. And for those, because it's a big clot and a big vessel, because of technology advancements, we have interventionalists who go in through your artery and actually pull that out physically, because it's a big clot and it's easily accessible. So for those ones, those are the Loma Lindas and the UCLAs and things of that sort. But for the majority of the strokes, once we're a stroke center, we should be able to take care of those here.
Are there any other questions?
Wow, no questions about monkeypox. Yes.
I guess I just want to be completely clear. Are you saying that if we do have a heart or a stroke issue, we should come to San Gorgonio and you would be able to treat us 24/7?
Yes.
And then would we stay there? Or did you say we then would have to be transferred after the initial treatment?
I'm glad you asked that question. So if you come into our hospital now for the services we listed, we're able to take care of you. That was our story 4 or 5 years ago, that we would transfer a lot of patients out of the hospital. Nowadays, if you come in, the things that limit us are not having a cath lab, so a pure heart attack, right? So those are usually the bigger hospitals that have a cath lab for heart attacks and stuff like that. But I still would warn you against not calling 911. If you're ever in question, just call 911, have the paramedics address what your underlying condition is, and they have standardized protocols of where to bring the patients. Last thing I want is for you to delay, right? Last thing I want is for you to think, oh, well, Dr. Singh said, we're not ready yet, so I'm not gonna go. No, call 911. Don't drive, don't put somebody in the back of your pickup truck. Just call 911. We already have protocols we've established through the County of Riverside with our EMS system that knows the capabilities of our hospital. And once we're a stroke center, they'll start bringing those ambulances to our hospital as well. If you come into our hospital now, we have board-certified, trained emergency physicians that work part-time at Loma Linda, part-time here, part-time at Riverside University, that are able to stabilize any emergency that you have.
Any other last questions? Well, I'd like to thank Dr. Singh and his administrative staff for coming out here and giving this amazing presentation. Thank you so much. Well, we have another speaker here, Chief Matt Hamner. You're out of uniform. I didn't recognize you.
I'm working undercover, but there's no crime going on in Sun Lake, so we're good. No, I just wanted to come and give an update. We've been, Michelle and Bob, right, have been very responsive to us, calling us when there's homeless individuals on Sun Lake's property, whether they're, I haven't heard of any in the showers recently. And I know we've cleaned up some parts over here, and I know they were talking about somebody might be able to pay for that. The sad part is if homeless people come on your property and and make a mess and leave trash and you have to clean it up, it's you. We have property owners, homeowners in Banning. They say the same thing. They'll have somebody come in and make a mess and leave trash and a mattress and a tent, and they'll want somebody to, code enforcement to come clean it up. If it's on private property, it's up to the homeowner. So I know that's very frustrating. I'm with you. If that's my property, but what you want to do is when they're there, call us. We'll come and arrest them. The problem is they have no assets. My dad used to say you can't get blood out of a turnip. You're not gonna get them to pay you back. They don't have any money to begin with. So that's kind of what we're stuck with. But hopefully you have found us to be more responsive when they come across the fence or they've been back with the RVs. So we are booking and arresting any crimes that are committed by them, and we find them doing that, even though it costs money to book and arrest them, and they release them within 2 hours. We're doing our part. That's what I feel like. We're doing what we can do. You as individuals, citizens, need to help change the laws. The laws are not on our side. So anytime you can call your state senators and state assemblymen, state assembly people, or governor's office, whoever, we need to change the laws. They have no teeth. There's nothing, we book and release. But we're going to continue to do our part. We have hired more officers. They're in training so that we have better response times and that we're coming out. I had a lady today, an older lady, comes into the station and she's very upset. She couldn't get an officer, so I talked to her. Come to find out, somebody called her and said that they had money for her, but they need to buy her 2 gift cards. I don't know why she did it. So she ended up spending, $500 or $1,000 and bought them gift cards. She said, no, don't tell anybody. This is, you're special. This is your award. We don't want anybody to know how much money you're getting. And so she's out that money, and she was very upset. She wanted me to go find them, and I said, I can tell you. She goes, well, it was a number from Banning. Well, they do that. When I was on Bainbridge Island, they called me on my cell phone, personal cell phone, and it was a 206 number, which is what Bainbridge Island is, and they said they were from the IRS and that if I didn't give them $4,000 that the local law enforcement was going to have me arrested. I thought, well, that's interesting because I'm the chief of police of local law enforcement. And they immediately disconnected, and I tried to call them back. I was blocked. My number was blocked. And so people think, well, they live right here on the island. They had a Bainbridge Island number. I don't know if you know this, but through computer-generated numbers, they can be in Nigeria and have a Bainbridge Island number. And a lot of the fraud and deception, identity theft is coming out of, and I don't know why. I don't know why Nigeria, but that's where a lot of it comes from. So here's what I told her today. I said, first of all, why? She goes, don't ask me why I did it. That's the first thing she told me. Don't ask me why. I said, well, let me say this. Anytime you get a phone call, now listen to this, because it's going to save you. If you get a phone call, don't you tell them anything. Don't you give them anything. If they say, hey, I'm from Amazon, and your account has, a $2,000 credit, or they try to entice you, what you do is you say, thank you, and you hang up, and then you go to your Amazon account, and you find the customer service number, and you call them back on that number, not the number that appears on your phone. If the IRS never calls you, by the way, it's snail mail. Now, if you get a letter in the mail from the IRS, nothing I can do for you. You're on your own. Don't call me. But the IRS will not call you. So if you get a call from the IRS, not true. Anytime anybody, credit cards, they call all the time. Hey, we believe you've got fraud. Someone's been using your card. And you click, hang up, you take out your credit card, you turn it around, you look for that number on the back, you call that number, and you ask them what you were just told. Now that is how you avoid being scammed or defrauded of any money. Never give anybody your routing number and your account number from your bank accounts. Ever. Nobody. Don't ever give it. What else? Do you guys watch our press releases in the Record Gazette? Nobody gets a newspaper anymore, I don't think. Do you get, what?
They're not giving us those reports anymore.
Oh, the blotter? No, yeah, now that I don't know about, but we probably put out 2 press releases a week. We've probably put out 10 to 12 in the last 2 weeks. Those have all been in the Record Gazette. So we just, we've had the transients, we talk about the problems with them. I've had an officer's teeth chipped. One of them slammed my officer into his own police car. Now, I can tell you, 40 years or 35 years ago when I was a first police officer, that wouldn't have happened, or if it did, it wouldn't have ended well for him. But he had no injuries. He got to go to jail with no injuries, and my officer has chipped teeth. I have another officer, my homeless liaison officer, got chewed up on the arm by one of the transients too. So she had to go to the hospital, had a big bite out of her arm. It drew blood. Luckily, she had a long sleeve shirt. If she hadn't, I think he'd have taken flesh, or the individual would have taken flesh. So my officers are being physically, teeth broken, bitten. So don't mess with these guys. You see them, you call us. That's what you pay us for, to get bit and our teeth cracked. Maybe not. But that's true. That's how bad it's been. So it's kind of an ugly scene. And I say this for those that think, well, the police aren't very compassionate. We offer every single transient homeless person in Banning housing, mental health services, drug rehab. We offer them everything, and they don't take us up on it. The ones causing problems, they refuse it. And so, the good Lord said he helps those who help themselves. I can't force them to take their mental health medication. A lot of them have medications they take. They refuse to take them. So they have these psychotic breaks, and that's what happened with this one that bit my officer. She had a psychotic break, and it was ugly. But so what I say is we offer them everything we can, but if they don't take us up on it and they're committing crimes, I'm sorry, mercy can't rob justice, right? So we book and arrest them. What else? Any questions for me? Concerns? Michelle, is there anything else you want me to cover? I'm trying to, I don't know, I don't want to just be repetitive from the last time. Okay, I mean, we catch them, we book them, but yes, that's nationwide. People are crawling in their cars with those cutters, and within 5 minutes, they've got your, $800 catalytic converter and are off. So no, we've done several search warrants and made several arrests for guns, for stolen property. If you look at all our press releases, just in the last, and they're all online actually. If you go to the City of Banning website, all our press releases on there, you'll see we've caught people with a bunch of stolen property. In fact, we caught all the guys stealing all the property out of the railroad cars, chased them down. We had a guy in the Jack in the Box lot attack a mother and a very young child. He ran from the police, assaulted the police, and ran from us, and we caught him and booked him, and he was on parole for burglary, breaking into people's homes, out on the street. I don't know about you, but that kind of guy should be in prison, but that's just me.
What I'd like to find out is the Opportunity Village, how many people are there, and are they taking advantage of the services that you're offering?
They don't have a choice, so they sign a contract. No drugs, no firearms, no problems. In fact, I just saw an email from, we have full-time security there, and we have a full-time individual who manages, I think his name's Roman, and he's running it. Anytime they cause issues, they're booted. They have 90 days to take advantage. So to Michelle's question, they're not there permanently. They get 90 days, and they have to get moved into some kind of housing or mental health services or drug rehab, and they have to move on. It's not permanent housing. We're not permanently housing anybody. So if they don't take advantage of it, they've moved out and moved along. So yes, some are taking advantage of it, and at the end of the 90 days, if they haven't, they're moved on.
Are there any other questions? Go ahead, please come up here. Please come up.
I'll help you. I could use the exercise.
Golf carts, I don't have a license. Oh, golf carts, I don't have a license. I've called the police department, all I've got is recordings, I asked for traffic, and to see, I figured that might be their division. Okay, I know we can cross Sun Lakes, you know, I guess it's okay. I haven't gotten a ticket yet. How about driving from, say, Gate 3 up to Gate 1 on the street? I mean, I haven't seen any police, or even some people go as far as the market, Albertsons type.
So it's not us you call to license a golf cart. That's DMV, Department of Motor Vehicles. We don't license golf carts. Can you drive it on the public street if it's not licensed? No. I don't want to say this, but that's the least of our concerns, is worrying about you driving a golf cart on the street when we've got burglars and everything else, and drug dealers and shooters, and we've had probably 10 or 12 drive-by shootings just in the last month in May. So they've got other things we're dealing with. So I'm going to tell you as police chief, no, don't drive it on a public street. It's against the law. Is that good enough? And I don't mean to be funny, but if you get out there and get in an accident or cause an accident, that's the problem, is you create yourself a lot of liability. Do we have time to put an officer down here and go, oh, there's somebody from Sun Lakes on the street with his golf cart? Probably not. Don't have time for that. But just because we can't do it doesn't make it right to do it. I would not do it. You create a lot of liability for yourself. You pull out in front of a vehicle, don't see it, it swerves, hits somebody on the sidewalk, they're going to put you in jail. You're going to go to jail for that. So that's what you know what I mean? It's like my 15-year-old son. Can I drive, Dad? I go, you don't have your permit yet. I know, but you're the chief. You drive, you're going to prison, or you're going to jail, because I'm not backing you. So that's my answer to you. My daughter, I have 7 children. I got called one time, once, and my oldest is 35 or 34. One time I got called when they got stopped by the police. She called me and crying, of course, right? Dad, help. Police got me. I'm like, what's going on? The plates on the car were reported stolen. They were. I had a truck stolen in Indianapolis, my own truck, and they took the truck out of the computer, but they didn't take the license plates out, and I transferred them to her car and sent her off to college to Idaho. So the police pulled her over, and I said, did they stop you because the plates are reported stolen? She goes, yeah. I go, let me talk to the officer. I get the officer, I'm like, why did you stop my daughter? He said, well, she was speeding first. I go, oh, write her a ticket. He said, I'm sorry, what did you say, Lieutenant Hamner? I was a lieutenant. I said, you write her a ticket. He goes, I'm not going to. She's crying. She said, I don't care how much she cries. You write her a ticket. I got 4 girls. I know how that works. You write her a ticket. And he goes, I'm sorry, I'm not going to write her a ticket. I said, put her back on the phone. I said, Christina, you lied to me. You said you got stopped because the license plate was stolen. You got stopped for speeding. I told the officer to write you a ticket. I hate you. You're a bad father. Click. I have never, that was the one call out of 7 children, I've never been called again, ever. So my answer to you, and I don't mean to make it that simple, I have to tell you not to do it. Could you get away with it for 100 times and not get, nothing's going to happen? Yes. You have to go to DMV to get something with a license on it. We don't do that. That's what DMV does to properly plate it. All I can tell you is if you do it and something happens, they're going to put all the fault on you because you shouldn't have been there to begin with. Does that make sense? So you could probably drive 1,000 times and nothing will happen. The problem is, one time, now you're not going to end well. You know what I mean? So.
I have a question here. I have a street legal golf cart. Beaumont offers, I have a street legal golf cart. Beaumont has some type of sticker or something that they put on my cart. They came over and made sure it was street legal. I can go over into Beaumont without getting a ticket, but I have to go down Sun Lakes Boulevard. If I'm going out of Gate 6, I'm on Banning side, I could get a ticket, but I can come home going
Does it have a license plate on it?
No. It's not licensed.
Well, maybe back to your question, I need to look into that. I've never heard of that.
Yep.
So I don't know if that's a Beaumont thing. I'm going to look into it. I'll get you an answer. Thank you. Was that what you were asking? Okay, I will follow up, and Michelle, I have your email, I believe, or Bob's. I will find out, because I know the chief of police in Beaumont. He and I went to the FBI Academy back in 2011, a good friend of mine. So I'm going to email and say, what are you doing? And I'm going to see what he says.
Just wondering what vacancies you have in the department, and what are they, if you have any, that you need to hire for now?
Say that again. What?
How many police are you down?
We're down 3. We're down 3. When I say we're down 3, we also have 4 that are in the process of leaving that aren't at work, but I can't replace them till they're actually off the books. So I'm down 7, but I only have 3 I can fill, and of those 3, 2 of them are going to be filled next Tuesday if those guys show up. Right now, all across America, like Seattle, who was a big defund the police department, they were all into defunding. They're now offering $30,000 signing bonuses if you'll come over there. So there's officers jumping all over the place going for the best deal. And so I think those 2 for sure will get here next Tuesday. That leaves me 1 plus the 4 that are on their way out. So we're doing better. That's why we've got a full-time homeless liaison. That's why we've got someone full-time on the gang task force. That's why we've got these other positions that are helping us for that very reason. So good question. We're still, and I've got 1 right now that's in training, so I'm really down 8. But as of next Tuesday, we'll hire 2 more. That leaves me 1 opening, and then again the 4. And as soon as they are off the books, I'll replace them. But we're doing better. We're doing better than we've done since we've been here in 3.5 years. But it's always a challenge. We have people, I just received a resignation today, somebody going somewhere else, and so I'm going to go do what we call an exit interview. I'm sure you all did that when you manage people and find out, why are you leaving, right? Why are you going somewhere else? Is it money? Is it environment? Is it workload? You want to find out why is someone leaving so you can correct those things. So as soon as I'm done with here, I'm going to go do an exit interview on somebody who just submitted a resignation. So, but that's not as an officer, but one of my civilians. Yes, ma'am.
Do you do training behind some lakes? Because we hear shooting like late at night back there, and I heard that the police officers do like maneuvering training. No? Seriously? I've been here 20 years and I've heard it.
Maybe it's an echo from our firearms range that's up off San G. Okay, so if you're here, if that's echoing back around, yes. So yes, we do have a pistol range we train at that's up San G, north of Ramsey. So yes, yeah, if you're hearing that, but yeah. But if you see somebody back behind there shooting, no, it's not us. Yes, sir. Well, the only training I know they do are close to their Larry Smith Correctional Facility, but not behind here in those open areas, I don't think. Yeah, I'm assuming you're talking about the back areas behind your fence. Yeah, there's nothing back there, unless they're doing guerrilla warfare, but he's right. There is other training explosions that occur, like a Larry Smith. They'll do flashbangs, so you could hear those too. But if you see people in that large empty lot, and you hear gunfire coming from them, I call 911. Yeah, that's probably being echoed.
I just want to clarify something. Everything you said is correct. We met with the Highway Patrol about taking a golf cart out of Sun Lakes. And here's what the Highway Patrol said, and they even showed us the law, the rule, and everything. It is illegal to take an unlicensed golf cart outside of Sun Lakes. It's a wives' tale about 1 mile from a golf course. That's not true. if you cross the street from Sun Lakes, you are illegal. Beaumont has an ordinance that they allow golf carts, but you are not allowed to leave Sun Lakes to go to Beaumont to take advantage of their ordinance. It's against the law. One woman on Highland Springs took the golf cart on Highland Springs, $825 ticket. No license, no tags, no insurance, no seat belt. The golf cart wasn't street ready. $825. Now, the Highway Patrol said, what you did. Do we have better things to do? Yeah. We're not going to sit out there and get Sun Lakers for crossing the street. But if a cop is in a bad mood, he will write him a ticket. And number two, what you said is the most important thing, the liability. Whether you're licensed or not, if you take that cart outside of Sun Lakes and you're not completely legal, somebody hits you, you hit somebody, it makes no difference, you are liable, you will be sued, and you're in big trouble.
Thank you all. Appreciate you having me here. Thank you.
Now I have Mike Romero from Securitas. He's going to give a brief update, and Lieutenant Roman.
Good afternoon, everybody. How's everybody having a good day, hopefully? My name is Mike. I'm the Director of Security here for Sun Lakes Country Club. This is Lieutenant Roman. We're here to offer, as usual, the best security that we can for the community. So I'll be real brief. I'll just want to go down a few items real quick with you folks. First and foremost, we're always asking residents to properly secure pedestrian gates in order to avoid any undesirables from entering through the gates. If you observe anybody entering through those gates that you don't think belong to the community, give us a call. We'll go out there, we'll check our cameras, we'll make sure we detain that person, ask them questions, and find out if they actually belong or not. We do get calls sometimes for guests that are registered. We try to not make a misconception of if they are allowed or not, but we'll definitely try to verify that as soon as possible. But do call us so that we can go out there and investigate as soon as possible. Patrol is frequently also doing more checks on our outer perimeters on the northern side of the community. We are checking beyond the train tracks and any breaches on the fenced property line. We're looking for homeless individuals and any suspicious activity around that area. I started implementing that in the last couple of months, and I have seen some changes in regards to not seeing actually any suspicious activity or getting calls from residents that they've observed some homeless activity in the back part. We are fully aware that we have some encampments back there, bless you, sir, but we do get in touch with Banning PD, like Chief Banning says. They have their homeless liaison, which we do contact and let them know, hey, there's an encampment back here, we need to get them off of the property as soon as possible. But us being out there on patrol, we do frequent the area mostly during the nighttime, during our swing shift, and the daytime. So we'll be checking that area roughly 3 times a day, okay? If you folks see any suspicious individuals back there, call us. If you see somebody attempting a break-in, call Chief Manny. He'll send his team out there and we'll get them stopped as soon as possible. But do follow up with a call to security, okay? We don't want to make sure that everybody's safe, and nobody's trying to attempt to stop these individuals because you don't know if they are armed and dangerous. So for your own safety, call 911, and we'll go out there after that, okay? Parking enforcement is a big issue here at Sun Lakes, as you know. We are continuing to frequently enforce any violations that we do spot throughout all hours of the day. My patrol officers will be issuing parking violations and place them on the vehicle. Just a friendly reminder, any guests or residents that are in violation will receive a citation. So we encourage you guys to have those passes displayed on your dashboard at all time. If we can't see the pass, the resident or the guest will get a citation. So we want to make sure that we see those passes, okay? Passes can be obtained through our gate officers. Administration can also issue any special pass should you need a longer extended time frame that exceeds the 3 days and 2 nights. We can only do the 3 days and 2 nights, okay? So if you need a week per se or longer than that and it needs to be printed out by administration, you can go ahead and get in touch with admin and they'll print that out so you can have it displayed on your dashboard. One more thing. Sun Lakes has recently, we're starting to enforce golf cart parking down at the South Clubhouse. I'm not sure if you folks are aware, but golf carts need to be parked inside the facility where the designated parking section for golf carts is. If you are parked on the street on Myrtle Beach or Birdie and you don't have a license plate, we will go out there and issue a citation. That's just standard policy here at Sun Lakes. Signs are out on display on the facility, so everybody should be aware about that, okay? If you have any questions, you can let me or administration know how we can better help you and where you can and cannot park. Garage door checks are still being performed between the hours of 8 p.m. and midnight. We will call you to inform you or leave you a voicemail in case we can't reach you. Security is not responsible for closing your garage door. That's not what we do. If you go out of town and you forget that your garage door was closed and you call us, I can't help you, unfortunately. But definitely get in touch with your neighbors. This is why Sun Lakes is such a great community, because of you folks. We're really tight with how we manage to look over for one another. So definitely make sure that you're closing your garage doors. Remember, there's about 3,200 homes here in Sun Lakes, and I only have a staff of 2 that are doing their rounds between the hours of 8 and midnight. So we're not going to catch all of them, but the ones that we do catch, we make it a point to get in touch with you folks, okay? We ask residents that are using the resident lane to have an active transponder and a resident decal on their vehicle. If you flash us a simple gate pass and you're a resident, that's not going to get you through, unfortunately. We got to verify that you are considered a resident, because we don't know every single person here at Sun Lakes. If you sell your vehicle and somebody else is driving your vehicle with an active transponder or decal, we're going to assume that you're a resident, right? So we want to make sure that everybody that's using the resident lane is valid. If you don't have that information, we're going to ask you to go through the guest lane. We are going to ask for either a Sun Lakes ID or your address with your security code. So be prepared. My officers will ask, and it's just standard policy to make sure that we're only allowing those that are allowed to come in through the community in, okay? To avoid damage to your vehicle, if you're using the resident lane, we ask that you be patient. Honor the stop sign, one vehicle at a time. It is an automatic gate. If I have 2 vehicles trying to come through at the same time, the vehicle in the back is bound to get some damage. We have beautiful vehicles, and we don't want to see any of those cars here in the community get damaged, especially us being held liable for that. Again, the gates are automatic. My gate officers will control the gates only when they need to. Patrol officers are also checking the facilities over at the North Clubhouse and Main Clubhouse pool areas. We're checking for children, make sure that they're not there after 2. Holidays hours are extended, such as Labor Day, which is coming up. We are going to have some families present here in the community, so we urge residents to always invite their families out, but always continue to oblige by the rules and regulations that Sun Lakes has. My officers will be out about on Monday for patrol, extra patrol, because it is a holiday. So we want to make sure everybody's having a good time and enjoying the pool, but at the same time, respecting everybody else's rules and regulations, okay? Any questions? Yes, sir.
Please come up to the podium.
I live on the corner of Myrtle Beach and Birdie, one of the busiest streets in the complex. I'm not an early riser. Do you have any limitations as to time-wise about gardeners or anybody else that can come in?
Absolutely. So Sun Lakes has a strict policy when it comes to work being done. Any work that has to be done has to get done between the hours of 7:30 and 5:30.
Delivery trucks?
Including delivery trucks. Because I don't have anybody at the gates, at gate number 5 specifically, which is our commercial gate, that one opens at 7 a.m. So workers are either going to come through the main gate, but if they're here to do landscaping work, we're going to prevent them from coming in until after 7:30.
6 o'clock this morning, there was a truck going through.
So delivery trucks,
it was a big white van.
A big white van.
Not
I'm gonna look
a
into
van,
that now.
a box.
Okay. So I'm not sure if it was heading towards one of the facilities.
No, it was going up Birdie.
It was getting up early. Okay. I can definitely look into that and find out exactly where that vehicle was going to. But landscapers such as artistic maintenance who are part of the Sun Lakes property, we don't actually tell them what time to start work. I'm referring to more of like your personal landscapers or personal contractors. They're the ones that are not going to be allowed entry after 7:30. Artistic landscapers, which are operated through Sun Lakes community, they have their own time. So I would urge you, if you have any concerns regarding them starting early, bring that up to one of the general managers here at Sun Lakes, and we'll definitely get that addressed to prevent them from doing or disturbing the peace during those hours, okay? Yes, ma'am.
How many vendors has Sun Lakes?
We don't bite. I'm trying.
How many vendors that do come in on a regular basis have a pass? I've seen a few go through the gates that are non-patrolled at all, like Gate 2 or so forth. I've just seen them just drive through. Are you aware of how many do have that?
Absolutely. I know for a fact that there are some vendors that are on some of the residents' permanent list. As you know, your permanent lists are people that we automatically allow entry that you have authorized as residents for us to clear. Contractors, I do see several listed on a lot of resident profiles, being landscapers that come once or twice a week, caregivers, or just a simple handyman that's here to check your air conditioning unit or your stove. We have familiarized ourselves with a lot of these contractors that do come. So in a sense, we get to know them. We get to know them by their first name, and they get to know us. They know the routine and policy here at Sun Lakes. So to answer your question, several. We have so many contractors that do come through, but we do tend to, like I said, get to know them so that way we know who's coming in and who's coming out. Sir, you had a question? No? All right, folks, thank you for your time. If you guys have any questions or concerns, my name is Mike. Feel free to call me. I am accessible to the community 24 hours a day. Also, get in touch with your district delegates. They are good in getting in touch with me as well. I'm currently revamping my entire department. We're trying to get things up and running a little bit more smoother. New staff, you're going to see a lot of new officers in the gate, so we just ask that you remain patient. I'm trying to get these guys to operate as soon as possible so that way they know how Sun Lakes operates with their policies, okay? Thank you for your time, everybody. I appreciate it.
Thank you, thank you. Okay, just a couple of extra little things here. Our next meeting is going to be, let me see, September 6th. This is our steering committee, if anybody's interested in coming to our steering committee meeting. It's September 6th from 1 to 2:30 in the bus room. Our next presentation is going to be on 9/29, and I'm going to be having Banning Animal Shelter, and also we're going to have animal control from the city of Banning. So they're both going to be here offering information about what Banning Shelter, and I do have flyers that I will be putting out pretty soon, and donations of things that they would need. I also want to let everybody know that Hernan has put on the website under community awareness. I have been getting so many calls about what people need or what they could put in their trash cans. Okay, first of all, I am not waste management. All I did was put on the presentation. However, Hernan did put in, under community awareness, you can click on that tab, and he put on there exactly what can and cannot be put in your trash cans. Again, I have gone through our neighborhood, and I have seen just, you can't imagine the things that are in the recyclable. There are so many things that are not recyclable. Please look and click on that information tab under community awareness on the website for Sun Lakes. So if you have any other questions, you can always contact me. My number's in the book. My flyers are always out. So I thank you for coming to our presentation and hope you'll make our next one. Thank you.